Now to the COVID-19 numbers. The Mississippi State Department of Health is reporting over 1,300 new cases and 36 new deaths from the virus. In total, more than 74,000 Mississippians have tested positive for the disease. And while today's numbers are back up, the amount of testing has gone down in the state. For more on that, we turn to Tao Ta with more. Tao?
Well, Byron and Melanie, Dr. Timothy Quinn says while the number of COVID cases has decreased in recent days, he cautions Mississippians to not let their guards down. Dr. Quinn points to the statewide low COVID-19 testing that may be a factor in the number of reported cases that have decreased in recent days.
There's a probability that there may be people out there that have COVID-19 not getting diagnosed because of the low testing, and now they're still out in the general population, potentially exposing others.
He says that hospitals and clinics are at capacity and overwhelmed with the recent turn of events. He believes that may be the reason why local clinics are possibly not reporting the positive and negative results, which is crucial to get accurate results. In a press conference this afternoon, State Health Officer Dr. Thomas Dobbs mentions the #1 reason why Mississippians are dying.
Most of the people who are dying today in Mississippi are not in nursing homes. They're people who live in the community. They're contracting COVID.
That ultimately, even with the low COVID-19 cases going down statewide, to still take precaution, mindful of the vulnerable.
We don't want individuals that are vulnerable, the elderly, those with chronic medical conditions, because if they get COVID-19, they can't fight it off as well, and in a lot of cases, they can lose their lives.
And Dr. Quinn stresses it's important to continue and wear masks, social distance among frequent hand washing as advised by the CDC.